family that came to treatment, they were very apprehensive about starting, wasn't really sure about the entire process of treatment. This gentleman was struggling with attending school and really couldn't make it to school, was very anxious, had a lot of trouble socializing with others, a lot of conflict in the family. During the treatment process, he attended group regularly, and he was able to process about his experience at school, what some of the barriers to attending school was, and particularly what was triggering his depression and anxiety. He reported a lot less anxiety by the time he went back and was doing really well socializing with his peers, and we were really proud of the successes he made.
We place a lot of value on training and education, and I've seen cutting-edge interventions that we've been using for these years have really worked. We hire licensed clinicians. They go back to do their continuing education. We have presenters coming in, providing updated information. We keep abreast. We are accredited by the Department of Addiction Services, DCBHS, Joint Commission. That does not happen in every organization, but it happens here at High Focus Centers.
We use dialectical behavioral therapy. That helps individuals that are dealing with some high-risk behaviors, particularly depression, suicidal thoughts, self-injury. We use all evidence-based treatment to ensure the success rate. We also have a lot of measures in place to measure the success outcomes, quality management, group supervision, and colleagues that really strive for clinical excellence.
An adolescent came in. She was an athlete, going to a good school, doing well on paper in life, but had pretty significant underlying substance abuse problem, and was really struggling a lot with low self-esteem, high expectations. The peer influence in the group really enabled her to feel some level of acceptance, enabled her to really feel a little bit better about herself and the positive things that she was able to do in her life and accomplish. We have a structure that we like to keep to. At the same time, we have to accommodate for the adolescents and the families, who many people work or have child care needs outside of the program. So there's flexibility in those days.
When the patient first gets here, the staff right from the get-go are talking with them, orienting them. They sit down with them, they go over what the program's about, what they can expect in groups, taking them for a tour of the facility and making them know that this is where they can feel comfortable, introducing them to their clinician, introducing them to the group, make it feel like it's a home environment for them.
It was a New Year's Eve. One of the patients began to talk about her relationship with her spouse, and the nature of the relationship was abusive. And then somebody else brought in another thing. She had lost her mother that year. And it was really more of a reflective type of situation. When we started to talk about what was going on with them and what the future held for them, became this very positive and upbeat moment. And at the end of the night, everybody was in tears and hugging each other, and there was this tremendous sense of support that everyone felt. And they spoke about that group for like a month after. They always talked about the New Year's Eve group. And I think what we do well here at High Focus is we help people to understand that their life is not over, that they're not destined to be chained to this addiction for the rest of their lives, and that we can help them get well and stay well.
The individuals who work at High Focus are committed to not only their job, but also the people and families that they work with.
What's going on in your life now is something that can be treated, something that can be helped, and we do that very well.